My name is Cyril Ruwende. I'm the current medical director of the cardiac catheterization lab here at Allegiance Health. PCI, or a percutaneous coronary intervention, which is commonly referred to as an angioplasty, is a procedure that occurs in the cardiac catheterization lab where we work to open up cholesterol plaques that are in the coronary arteries. Typically, patients will go into the cardiac catheterization lab, get medications to help them relax, and we then use different approaches to enter into the arterial system. We can go through the groin or the femoral approach, or we can go through the arm, typically the radial artery in the arm. And it is through that entry site that we go with catheters and guide wires into the coronary circulation, inject IV dye, and take images of the blood as it flows down the different arteries. When we get to the angioplasty portion of the procedure, we typically will give blood thinners and then use balloons and stents to open up the narrowings in the coronary artery that are caused by the cholesterol plaque using balloons and stents and occasionally other more specific devices.
I'm Dr. Hassunizadeh, work at Allegiance Health. I'm one of the interventional heart doctors. About a year and a half ago, our group started introducing even less invasive ways to get to the heart and doing the heart catheterization. Instead of going from the groin, which is called the femoral heart cath approach, we are now, in a majority of the cases, using the wrist as an access site to the heart, making this even less invasive. The data we know about heart catheterization shows that bleeding is a major risk factor, and bleeding directly correlates with death. And from the wrist, the bleeding risk is basically zero compared to the groin, where there is still, especially in heart attack settings, a significant bleeding risk. Now, the good thing about this wrist approach is that probably about 99% of patients have a good wrist artery, and we are able to use the wrist as an access site for the heart catheterization. The only few exceptions would be patients that do not have a pulse on the hand in the wrist area, or people that have very curvy arteries around the shoulder. Other than that, the indications for the wrist procedure are exactly the same as for the femoral, and basically most patients, if not almost all patients, qualify for this procedure.
Typically, when we do PCIs, they can be set up as an outpatient or they can be done in inpatients. The tradition has been that when someone comes in for a PCI, that they would stay overnight and go home the following day. So it's like a day surgery, day procedure, where people come in and leave the hospital, within 24 hours. There are data that would suggest that for some patients who are at low risk for complications, that they may actually be able to have the PCI on the same day and go home. And the radial approach, because again, it's associated with less bleeding and blood vessel damage complications, actually lends itself towards that approach where patients could typically come in, have the procedure, and go home on the same day.
It's interesting to see that in the whole United States at this point, only about 5 to 8% of hospitals use the radial approach for their heart cath, even though it is shown in more and more trials that it is beneficial for the patient from a convenience standpoint, and even more in the emergent heart cath setting from a survival standpoint. The reluctance nationally is mainly because there's a learning curve for the doctors, and a lot of doctors are reluctant to pursue that, and it will take several hundred heart caths to be proficient at this procedure, even if a doctor has done hundreds or even thousands of heart caths in the past. And there's a lot of reluctance in the community of doctors to start doing these caths, which we have started doing about 1.5 years ago, and we feel very proficient at doing these procedures now. And once the experience level is there, the patient benefits from it, and the staff benefits from it, and basically there's only advantages to this procedure. In emergency situations, it's interestingly, the benefit of going from the wrist is much more than from in non-emergent situations. In emergent situations, the bleeding risk is much more higher because of the enormous amount of blood thinners that we use for these procedures, which include not only aspirin but heparin and several other groups of blood thinners to open the heart artery and to keep and dissolve the clot. Interestingly, for regular heart caths, elective procedures in people that come in with chest pains, not with a heart attack, the benefit of a cath from the wrist is mainly patient comfort, because patients can be immediately ambulated and don't have to lay on their back for 6 hours, and less pain involved most of the time too. And basically in emergency situations, because of the fact that the wrist approach almost avoids the bleeding complication, there is a known 2% reduction in death that can be achieved with the wrist approach. And this has been shown in several trials that are recently published. It seems that in the acute heart attack settings, the wrist approach is even more beneficial than in the regular elective procedure. Well, here at Allegiance Health, the doctors that use the radial approach feel very comfortable and are very experienced in using this approach, and basically allowing the patient to have a much more convenient and comfortable procedure, but also, especially in the acute heart attack setting, improving the chance of survival.
I would encourage anyone who's having a heart cath procedure to talk to their cardiologist about the different approaches, radial versus femoral. There are instances where the femoral approach may have some advantages, but I would say for most patients, the radial approach is a decent option. So I think on a case-by-case basis, I would certainly encourage patients to talk to their provider, go over the pros and the cons of the radial versus the femoral approach. And ultimately, the provider should be able to give them their recommendation for what is the best approach for diagnosing and treating their cardiac issues.